If you look at your ankles and see sock marks, if your shoes feel tighter by evening, or if pressing the skin leaves a temporary dent, that is called edema, fluid collecting in the tissues. Edema is common after 60, but here's the key. It is a symptom, not a diagnosis. Sometimes it is harmless, long sitting, heat, high salt meals, and sometimes it is a warning sign that needs medical attention. Seek urgent care today if swelling is sudden, especially if it's mainly in one leg, or if you have severe leg pain, redness, fever, chest pain, shortness of breath, fainting, or coughing blood. Those can be signs of a blood clot or heart and lung problems. If swelling is gradual and in both legs, schedule a medical review, especially if you also feel more breathless, tired, or you wake up short of breath at night. Let's stay practical. In older adults, common causes include chronic venous disease. Vein valves don't close well, pressure builds, and fluid can pool in the lower legs. Heart failure or other heart conditions, the body retains fluid and pressure backs up. Kidney or liver disease, fluid balance changes. Medications, some blood pressure pills, anti-inflammatories, and others can cause swelling. Lymphatic problems, inflammation, or infection. That's why I do not want you to self-diagnose swelling as just one thing, like collagen loss. Vein walls do remodel with age, but edema has multiple serious possibilities. If your clinician has ruled out urgent causes and you're dealing with chronic, evening worse swelling, these are the safest foundations. Movement breaks. Stand up and walk a little every 30 to 60 minutes. Your calf muscles help push blood and fluid upward. Leg elevation. When resting, raise legs above heart level for short periods if comfortable. Salt awareness. If you've been advised to limit sodium, follow that plan. Compression can help venous symptoms, but in older adults it should be chosen correctly, especially if there is peripheral artery disease or neuropathy. Ask your clinician which level is safe. And one more rule. If you take a prescribed diuretic for heart failure or another condition, do not stop it because of an internet video. Diuretics are often essential for relieving fluid overload. Any change belongs in a medical visit. Now, nutrition. Foods do not drain your legs like a prescription medication, but a diet rich in vegetables can support vascular health, blood pressure control, and overall inflammation balance. Think of food as a supportive layer, not a replacement for diagnosis or treatment. Here are 6 vegetables from the original list, reframed responsibly. Number 6, beetroot. Beets are nitrate-rich. In some people, dietary nitrates can modestly lower blood pressure and support vascular function. If you already run low blood pressure, feel dizzy when standing, or take multiple blood pressure medicines, be cautious and discuss with your clinician. Also, beets can be high in oxalates, relevant if you have kidney stones or kidney disease. Number 5, carrots. Carrots provide carotenoids that the body can convert to vitamin A. Vitamin A supports normal tissue function. Absorption varies and is often better with some dietary fat, so carrots with olive oil, yogurt, nuts, or eggs can be reasonable, but it is not true that you absorb almost nothing without fat. Number 4, red cabbage. Red cabbage contains anthocyanins. That's interesting nutritionally, but it is not a proven treatment for peripheral edema. Important safety note, cabbage and other greens can be high in vitamin K. If you take warfarin, the goal is consistency, steady intake, and INR guidance, rather than sudden large changes. Number 3, Brussels sprouts. Brussels sprouts provide vitamin C, which is required for normal collagen formation in the body. That supports general tissue maintenance. But vitamin C is not a direct vein repair drug, and it will not replace medical treatment for venous reflux or heart failure. Number 2, spinach. Spinach contains magnesium and potassium, plus vitamin K and oxalates. Magnesium is essential nutrition, but magnesium supplements have not shown reliable benefit for muscle cramps in older adults, and spinach intake has not been proven to drain ankles. If you have kidney stones, boiling can reduce soluble oxalates, and portion size matters. Number 1. Parsley. Parsley is nutrient-dense and can contain more vitamin C per gram than oranges, but people eat very different portion sizes. Parsley has been studied as a diuretic mostly in animal models and extracts, not as a proven, safe, natural diuretic for seniors with edema. So, enjoy parsley as a food. Do not use it as a substitute for prescribed diuretics. And if you take warfarin, keep vitamin K intake steady. If your swelling has been medically assessed and you are working on lifestyle support, here's a simple plan. This week, add 1 extra serving of vegetables per day. Choose from any colors you like. Aim for consistency, not extremes. If you're on warfarin, keep your green vegetable pattern stable from day to day. If you have kidney disease, kidney stones, or advanced heart failure, ask your clinician which dietary changes are appropriate. Let me summarize in 1 sentence. Leg swelling is a symptom, sometimes benign, sometimes urgent, and the safest path is triage first, diagnose the cause, then use lifestyle and nutrition as support. If you want, write in the comments, is your swelling sudden or gradual? 1 leg or both? And are you taking warfarin or a diuretic? This helps me create a follow-up script with the right safety focus. I'm Professor Alexei Kalmikov. Thank you for watching.